Now, according to the Ministry of Health, more than 15 people will be discharged from the different isolation centers in the country to raise the number of people who have recovered from COVID-19 to 18. On Saturday, 4 of these came from Entebbe Grade B Regional Hospital, and earlier our reporter, Kamana Ivan Walunyolo, who is in Entebbe, spoke to the director of the hospital, Dr. Moses Mwanga. Yes, Ivan? Ivan?
Well, Andrew, it sounds more of magic for someone to enter the gates of the hospital when he is a patient or she is a patient to coronavirus, COVID-19, the deadly pandemic globe-wise. And after a certain period of time, you're told that you're negative and you have to be discharged. If you just remember on Saturday, the Ministry of Health with other government officials discharged 3 people from this hospital and say that if all goes well today, which is a Monday, more than 15 will have to be discharged. But a very good morning to you and our audience. I am coming to you from Entebbe Regional Referral Hospital, whereby we want to understand from the director of this Regional Referral Hospital, how have they prepared the 15 who are to be discharged today, and how are they also, how have they prepared the integration process with these people when they will be returning to their homes. Dr. Moses Mwanga, welcome with me on Morning at NTV.
Yeah, thank you so much. I'm Dr. Moses Mwanga, the director of Entebbe Regional Referral Hospital.
Doctor, you discharged 3 people last Saturday.
Yes.
What a feeling like for you as medics who are manning this here at Entebbe Regional Referral Hospital?
Wow, I would say that this was like a miracle, because when you hear it from globally, how people are dying in other countries, to us as a hospital, when we got the first cases of this pandemic, the hospital was all at panic because this is a new disease. But we had to prepare ourselves as health workers, as a medical team, because I have a team of over 70 staffs, the physicians, the doctors, the nurses, the hygienists, and the laboratory team. We had to prepare ourselves. One is we wanted to make sure that these patients of ours get much better. And again, we wanted to also ensure that none of our staffs gets infected. So yesterday when we discharged the 3 of their patients, I think one of our objectives was met. One, we are happy to see that the people who came in with tears, with sadness, with worry, and along the way as we were treating them, they had a lot of depression. These people got better, and as we discharged them, I would say we felt like heroes. We felt like we have done our part. We felt like at least we have given our country hope that people can get better.
How was it easy or hard for you to integrate these people into their communities?
I wouldn't say it was very easy, because initially when some of these people were diagnosed COVID positive, the community rejected them. We want to thank the community because the action of the community was very good. Everybody who had traveled outside, they would call us. We have a neighbor here who traveled to Dubai, who traveled to America, who traveled to wherever. He's inside house, come and collect him. So the response was easy to track all the people who had traveled outside. But now the issue is when they get better, how do we convince the community that this person you had rejected is much better? So we sent a team of the risk officers, social workers, who went down to the community to inform the community that we are bringing back your people, they are much better, they are healed. And the experience was not very nice, because the community had to ask them very many questions. How sure are you that when this person comes back, we hear people dying outside, how the person, won't we get infected? So we had to reassure the community, and we are happy that the Prime Minister was here with us. He's one of the person who reassured the community. Our Minister of Health assured the community. The Director General of Health assured the community. And I'm also assuring the community that these people are healed, they are okay. They have done tests which have confirmed 2 tests following the test that they are negative, and they are clinically okay. They are only psychologically traumatized. We call upon the community to help them integrate and be accepted in, counsel them, give them hope, show them that they're loved, because psychologically being in quarantine for 21 days is not easy. They had a lot of experience you can never imagine, because even we as health workers, those people we treated don't know us by face. The way we dress, You just dress that the person is only seeing the eyes, and you don't know who is who, not until when they're discharged. They can't tell you that Dr. So-and-so treated me by just knowing the name that I'm Dr. Mwanga, but they don't know you by face. So they had that scare that really I'm being treated by, if somebody can dress like this, that means the disease I'm carrying is really horrible.
But doctor, you hold it there. What does it mean to you as a person, an individual, to be in charge of a hospital that is treating COVID-19?
Initially, it was a bit challenging, and it was a hard task, because I would say all the eyes are on me, especially my bosses in the ministry. The president is on me, everybody is on me. What happens next? And I have to update my bosses, especially the ministry officials, on daily basis, on hourly basis, whatever transpires. So I was always on the lookout. I was always to ensure that none of my staffs get issues. So it was a bit challenging. But along the way, as we stabilized, I felt a bit proud, because I don't know how many phone calls I get from all categories of people. Big, small, medium, average, you know. At times, initially, it looked as if it's a bit of a nuisance, because the community kept on ringing me. We have been given your number. To make matters worse, even other illnesses, people would ring you. But later I felt that I had the answer to give the people.
But you, even if you are a medic, does that in any way show a sign that you got maybe psychologically disorganized in as far as how you're receiving a lot of calls and, you know?
Initially it was a bit disturbing, but with time I came to accept it, because there are issues which were concerning directly COVID. Those were directly my responsibility. Then the other diseases. A mother rings you, the doctor, I'm stuck, especially after the lockdown. Issues with the people, referrals, mothers are going to deliver, the baby is sick, somebody has got a problem, they would also ring me, because my phone number had been shared, that in case of any health problem, ring this number. But with time, I had to cancel myself, and I had to appreciate it, and I had to give answers to the people. And I had to ensure that my phone does not go off. I had to keep on updating the ministry of whatever is happening, any changes. Have a team of clinicians, especially the physicians, the doctors. They had to update me on a daily basis what is going on, because I had to have answers to give the Minister of Health, the Director General, to ensure that everything goes on well.
Did this in any way affect other patients who were coming to receive a treatment from the same hospital?
Yes, it did a lot affect the other patients, because when we got the first confirmed case, Entebbe is a referral hospital which has a comprehensive services, not only emergency diseases. It has all services, outpatient services, casualty, internal medicine services, obstetric services, pediatric, and other chronic disease services, HIV, hypertension, diabetes. But when we got the first case, somehow it was like a scare. People ran away from the hospital, especially the outpatient department. The mothers decreased suddenly. Would get our maternity ward flooding, even floor cases. The day we got the COVID positive case, somehow people started discharging themselves. So when we got more cases, we had to expand wards. We had to create more wards even for suspects. Somehow we had to lock down other services and refer them to other sister hospitals. So I think somehow, because we're a referral hospital for these other lower services, there was a bit of shift of services to the lower size health centers, and it was a bit of a burden to them. We supported them with some drugs, and we're in plans of attaching some of our staffs to them, especially the midwives, to help with the crisis.
And how did this generally take your employees?
The employees themselves, some of them were scared. It was something new. We have a variety of employees, the young, the elderly, the chronically sick. You know, when you're managing COVID, you don't have to be a person with chronic diseases. So when we are building a team, we had to advise people. Even people themselves, they know about COVID. So people knew, if I'm above a certain age, I can't be part of the team. If I have chronic diseases, I can't be part of the team, especially the hypertension, diabetes, HIV, cancers, and your age per se, you can't be part of the team. So those were automatically eliminated from the group we had to build. Then the other team, the others who are, I would say, they are cowards. You know, they fear the scourge. They can't stand the pandemic. So somehow they shied away. Then I have the team which has a positive attitude. Those ones who said we have to continue the battle. Others, it's just a mere fact that they belong to that department. It was just inevitable that they had to become part and parcel of the team. People like myself, whether I was a coward or not, I had to be part of the team because I was the leader. If the leader fears, then who won't fear? There are people like the administrators. They couldn't. This disease is mainly in the internal medicine. I really want to thank our physician because he stood strong with me, the medical team. The physician, Dr. Chris Inseleko, I really appreciate his work. He really stood strong with his team of young doctors. Dr. Menya, Dr. Emma Ramutwe, Dr. Morris. These people stood strong. Then the biggest team is the team of nurses because COVID is mainly a supportive, you know, you have to support that person. So there's more of the nursing care and the small treatment. You know, you need much of the nursing care, supporting this person. So the nurses are the majority. So the principal nursing officer with her team, Sister Mutonyi Walimbwa, played a very big role. And the administrators, especially Mr. Mpanga and Seranga, played a big role. Plus my team other members. There are some people who also play from the back. Our accountant, Hajat Walia, played a big role. My deputy, Dr. Pmal. You know, we do a lot of planning when we sit together. So we had to plan to ensure that a hospital manages this pandemic.
Treating these people from your hospital, has this in any way changed this referral hospital?
Yes, I would say yes. Yes and no. Because yesterday when the Prime Minister was releasing these people, he really said, Entebbe Regional Referral Hospital, you have registered being the gurus of managing COVID-19. So it lifted us to a certain level because we have made people get better. So I think we're at a certain level. There's no way in any corridor of ministry, if they talk about COVID, they have to talk about Entebbe Regional Referral Hospital. Any referral, anything to do with COVID, I think Entebbe has to be on the front line. So I would think it has changed the hospital status. So we don't know the future of the hospital, either we are going to become we already have a national isolation center. We don't know if they are going to put us into that, managing pandemics and epidemics, but I think it has changed the status of the hospital. Even the staffs themselves having that confidence, it has really changed them. I'm sure even if they bring in 50 tomorrow, I won't run away. We are more than ready for them.
Doctor, one of the patients who was brought here was an expecting mother, and we are told that she went through a cesarean process. How hard or how was it easy for your team to attend to her?
Oh, that was another scenario because as an isolation center, we didn't expect that we can also have expectant mothers in the isolation center. We had so many quarantines around our area. So we're called one night that we have mothers ready to deliver, and they are then quarantines. But being a regional referral hospital, we had some midwives on the team. That wasn't a big problem. We delivered the mothers, but we didn't know it would reach a level of the cesarean section. So the D-Day comes, I was called by the Director General that there's a mother for cesarean section, and this mother was a confirmed case. The issue with an operation and somebody who's confirmed is taking so many hours with that person together and with close proximity. You are with that person, you can't avoid. You can't have social distancing. You have to be with the person nearby in order to have the operation be carried out. Just stand side by side. So the issue was not the operation, the issue was the safety of the staffs involved. So many other hospitals rejected the operation because this lady had not attended in our hospital, but many hospitals were telling the hospital which manages COVID is Entebbe, go there. But in our planning, we had not planned for operations. So that time we had to accept because we had already accepted managing COVID, but this was a special COVID patient operation. The issue was, how do we come out with my staff safe? So we had to build a team and to ensure that these team players come out safe. The doctors to operate, and when you are in close proximity with these patients, you have to put on proper protective gear. And as these people put on the protective gears, they are not supposed to take more than 45 minutes in the ETU. So the issue was, how can these staffs carry out the operation within the shortest time possible, without limited side effects, and come up with the right outcome. So we rehearsed with the team, we got the best surgeons possible, we trained them. The issue was making sure that they can stay longer in the protective gear on the table, because you cannot predetermine how long you take into that operation. Because if you're putting on the protective gear and you're psychologically knowing that this person is positive, any mistake I make, I get it, you know? So that was the issue we had carrying out. So we built a team, 2 surgeons, senior surgeons, the nurse received. The anesthetics now became an issue because we had to give this patient anesthesia. So I was told, get in touch with anesthesiologists, you know. So we had to build a team, and the team had to be a team of confident people. So after rehearsing and preparing everything, the team went in well. And I'm happy to report that they came out well. I want to thank that team, the doctors, the nurses, and especially the anesthetists who went in and ensured that that mother came out well. We delivered a live female baby, I think our first cesarean section baby girl, and the mother was extremely happy because she didn't know, after being tossed around with many other hospitals, that we can't operate you. And with the stigma of carrying COVID in her, she was already traumatized. This was a mother, a wife to a person who traveled abroad. So when the husband came back, he infected the mother, who was pregnant.
And now was the man himself negative?
The man is the one who traveled abroad, was tested COVID positive, but he had already united with the family and ended up infecting the wife.
Now, how are the status of the 3, the baby, the mother, and the
So after the
father?
operation, we had to unite the 2. The husband was extremely happy because the husband was positive, the mother is positive. But we tested the baby, and the baby is okay. The baby is negative and has no problem.
Wow. Now, Doctor, someone would want to understand, today, a Monday, they told the Ministry of Health, let me say the Minister General, saying, if all goes well, you're going to discharge more 15. How are their status? What are their status? How have you worked upon the reintegration process into the communities that they're going back to?
Ideally, I want to inform the public that we are discharging more patients, but we need to prepare the community. We have already prepared. Here in Entebbe Hospital, we have 7 more. We have 4 more who are going. The others, I think, are in Molago. Yesterday we discharged 3. Today we are trying to prepare the community for 4 of them, and most probably tomorrow we'll be letting them go. So you need to prepare the patient. You need to prepare the relatives. You need to prepare.
So today being a Monday, so how many are going to leave this referral hospital, joining the communities?
I think 4 more are going to leave the hospital to join the community.
And what are their status? And
have
you prepared their communities they're going to?
We have prepared the patients themselves, but we are preparing the community. We are preparing the community because many of these patients come from far. Kayunga, 2 are coming from Kayunga, there are others coming from Masaka. So our risk officers, the social workers, have visited the communities, and especially the community of Kayunga. I'm calling upon that please integrate these people well, because it's a big family. The husband, the wife, it's the wife who traveled, came back, infected the husband, and the entire family has been with us. The husband, the wife, and the 4 children have been staying with us for 21 days. Because even the relatives rejected the children, because they said, if the husband and the wife are positive, chances are high that the children are positive. And these children are really children, because there was one of 11 months, 3 years, 6 years, and 8 months. The mother said, you can't part me away from my children, and it's her right. So it was a big challenge staying with these children, with the parents, for over 21 days. So we call upon the community to really accept these people. They need support. They need really to be told, it's okay, we have accepted you. They need a lot of counseling, and they are okay, they are fine, they don't have any problem.
And doctor, as you're discharging them, how many more are you now taking care of, and what are they improving to also seek a discharge maybe very soon?
We had a total of 30, so if we remove the 7, then we remain with 21, but we still have suspects. The word of suspects every other day from the quarantines, they keep on bringing in people who develop symptoms. So we discharge 6 in the morning of negative suspects, return them to the quarantine, then they bring in more. So, and from the suspect ward, if you turn positive, you join the confirmed ward. So we have 21, but I don't know how many will join from the suspect ward, but we are lucky that none has joined from the suspect ward, but we don't know what goes on. So, but presently we have the 21, they are doing well, they are promising. The majority are below 40 years, they are young, between 21 and 30 years. It's only 2 who are above 50 years, but they're also doing well. And we hope if everything goes the way it is going, with my medical team, we will discharge all of them.
Well, Director of the Entebbe Regional Referral Hospital, Dr. Mwanga, giving us an insight and of course updating us on the status of the patients who are here in the hospital, but also assuring the public and giving them, information that they should not try to turn away from these people. They are now part of them and have been part of them. Doctor, thank you very much for your time with us on Morning at NTV. We wish you well as a team in all your endeavors.
Thank you so much. I also want to thank NTV for always updating the community of what is going on. And I still also call upon the community that let us keep what the president is telling us. Let us wash hands. Let us not be so happy. Already people are ringing me, telling me, doctor, since you have discharged those patients, it means the pandemic is over. It's not over. We are still under lockdown. We are still tracking those contacts the minister told us. We don't know if out of those ones we'll get some confirmed cases. So take charge, keep home, wash your hands, social distancing, and pray for us. I think if we work together with the President's guidance and the Minister of Health, we'll overcome this pandemic. Thank you so much.
Well, Dr. Moses Mwanga assuring the communities and of course also giving an insight of what the status of these more other people, the more other patients who are to be discharged, like here at Entebbe Regional Referral Hospital. Chamagero, if you have been sick yourself and maybe feel so more depressed and gone to the hospital, and then the medics come to tell you that you're now okay, you can enjoy the rest of your life. It's what a feeling, more than being happy. And just if you are so observant, when they were discharging the first 3 patients from this hospital here, the happiest community were the medics from this same hospital here. If you have been sick, like I've said, and you have gotten to be fine, you know what I'm talking about.
Oh, yes, indeed.
And the doctor is assuring the public. Well, Morning at NTV continues, and this is Entebbe Regional Referral Hospital. Back to you in the studios.
Thank you, Ivan Walunyoro in Entebbe. Well, it's very, very gratifying to see such a remarkable team there. Well, they're